You know, menopause can be miserable. Almost on a daily basis, I encounter women experiencing weight gain, mood changes, difficulty sleeping, and vaginal dryness during this time period. But those who suffer the most tend to be the ones with the severe hot flashes, hands down. It can really interfere with the quality of life and makes it difficult to even function in some patients. Now, although there are other treatment options besides hormone replacement therapy or HRT, truthfully, nothing is quite as effective as HRT. But is it safe? I'll review the pros and cons in today's video so that you can make an informed decision when you discuss it with your doctor. Well, what's up, healthy people? I'm Dr. Majd, the practicing board-certified family medicine physician in San Diego. Make sure to subscribe for home treatment tips for common medical conditions for you and your family. Now, what you need to know is that the practice guidelines for doctors primarily stem from a large groundbreaking study called the Women's Health Initiative, or WHI, in the 1990s that really changed the way that the medical community viewed HRT. Understanding the findings of this study is vital to your decision making. Briefly, it included over 27,000 women with an average age of 63 who were either placed on HRT or a placebo for an average duration of 3 years. Then the rates of various medical conditions were compared between the two groups. So here's a quick summary of these findings for women that still had their uterus and were placed on estrogen-progesterone HRT combo, which reflects the majority of women that are seeking HRT. Okay, so let's talk about the cons first, which is what everyone really is concerned about. First of all, there's an increased risk of heart disease. And for every 10,000 women taking HRT over a 1-year period, only 5 extra heart disease diagnoses were made in women in their 50s. So only 5 out of 10,000. But 19 extra cases among women in their 70s. So there's a huge distinction depending on the age group, as you can see. The second risk was breast cancer. Now, in comparison to heart disease, for every 10,000 women on HRT for 1 year, there were 9 extra breast cancer cases total. Now, HRT increased the risk progressively to about 24% overall, even after stopping HRT for some reason. If you opt for HRT, make sure that you remain up to date on your breast cancer screenings. There was also an increased risk of stroke, and for every 10K women on HRT, there were 9 extra cases. Blood clots in the lungs. There were 3 extra cases found. And there was increased risk of gallbladder disease and urinary incontinence by about 50 to 60% for both. All right, so now let's talk about the pros. First of all, besides the benefits of HRT this study has found, keep in mind that one of the greatest pros of HRT is that it's hands down the most effective treatment for hot flashes, although not the only option, certainly. Also, it decreases the risk of hip fractures and 6 fewer cases for every 10,000 women that were treated for 1 year. There's decreased risk of colon cancer. There was only about 0.5 fewer cases, but those who did develop colon cancer, it was discovered at a more advanced stage in the study. And lastly, it decreases the risk of diabetes, interestingly. There were 16 to 21 fewer cases per 10,000 women. All right, so here's the bottom line. HRT is not recommended as a treatment of menopausal symptoms for women aged 60 or more. However, most women who seek HRT are typically in their late 40s to early 50s anyways. So for younger women in their 50s, or for those less than 10 years past menopause, without risk factors who have a uterus, short-term use of treatment, no more than 5 years, poses little risk based on these numbers, as you can see. Now, are you considering HRT or are you already taking HRT? Share your story with us in the comments down below. If you found the information useful, which is always my goal, let me know by giving it a thumbs up and share it with someone else who may find it useful. And don't forget to hit that red subscribe button down there and that bell next to it in order to learn more useful, actionable health tips for the busy person who can't always make it to the doctor's office. Now, please note that all content presented is for informational purposes only. It's not specific medical advice, and you should always seek a licensed physician in your area for all health-related concerns. Well, thanks for tuning in. Stay hot flash free, and I'll catch you next time.